Get 2 or more chiropractors in one room, and then arguably the most contentious topic they're going to discuss is this whole concept of knowing when a patient is done with active care. Now, obviously, maintenance care or wellness care begins when the active care program is complete. And that type of care is an entirely different discussion that we'll save for another day. So do you ever stress over determining when your patient is done with their active care? If so, you are absolutely not alone in this profession. There's massive disagreement on this issue, yet I'm going to make it simple and very straightforward because when you're properly equipped, it is not complicated whatsoever. In this video, I'll discuss with you an approach to patient care that is easy to incorporate and simple to implement. It's completely transparent, and best of all, it requires no expensive equipment, apps, or repeat x-rays, none of that stuff. I'm Dr. Chris Tomshack, CEO of HealthSource, America's Chiropractor, and you're watching the Chiropractor Solution channel, which is a video series that helps you grow your practice and your career both professionally and personally. Now, before we dive into today's topic, if you would, please make sure that you're subscribed to this channel so you can continue receiving these videos. And please give us a thumbs up if you like the content to make it easier for other chiropractors to find this channel. That's how it works. Now, when I was in college, our professors rarely spoke about treatment plans, and when they did, they related 1 or 2 scenarios. And scenario number 1 was that when a patient was almost out of pain, you'd start stepping down care, and so they're pretty much done with chiropractic care. Scenario 2 was a rehash of some ancient dogma that stated patients should be seen 3 times a week for 4 weeks, 2 times a week for 2 weeks, and then 1 time a week for 1 week. This has zero science backing whatsoever. It is pure dogma. Now, in my opinion, both of these plans, they fall terribly short. That said, if your overall goal is to get a patient pain-free or nearly pain-free, then follow scenario 1, which was simply to release them from care when they're almost pain-free, pretty much there. In that case, you're following the standard physical therapy model. If that's really what you and your patients desire, that's the correct route for you both. But you can do so much more for your patient than just pain relief, and I'll get to that in just a minute. Now, if you're following scenario number 2 and putting all of your patients on the same treatment plan regardless of diagnosis, severity of injury, or chronicity, this plan of care belongs in the trash heap. It's based on dogma and nothing else. It is the main reason that we hear the statement frequently when you're in practice, hey, I tried chiropractic, it didn't last. Then the pain returned. Now, a lot of chiropractors show their patients x-rays and then tell them they are going to change how that spine looks on x-ray, whether that's an alignment issue or it's a function issue. Well, if that's the case, then a set of repeat films should clearly indicate that those changes have been made and the patient can be released from care when that goal is reasonably attained and then move to wellness care. If that's not happening, then it's clearly time to be a lot more transparent with patients. Chiropractic's growth really depends on it. There are a few techniques that, when done correctly, they do achieve some very nice changes that can be seen on films. And if that's your technique and your practice is utilizing it correctly, such as CBP, you easily know when the patient has finished care. But most chiropractors aren't practicing with one of those techniques. So how do you know when a patient is ready to be released from care? Is it purely based on pain relief or changes on x-ray or curves? Is it something else entirely? Please let us know in the comments section what you're doing. This will be of interest to a lot of other doctors. Now, if releasing patients from care is not based on repeat x-rays that demonstrate maximum change or based on some blanket treatment program that most patients receive or based on pain relief, well, how do you know when a patient is truly done? The answer is straightforward. When you examine the patient initially, you're required to list the goals of care, correct? Yes. And a goal for care can be pain relief. It could be structural improvement to a specific degree or a host of other things. A goal for care is not putting them on a monthly subscription plan of 1, 2, 3, or 4 adjustments a month till they drop off care. You already know that to be truth. Now, here are my thoughts after having treated many thousands upon thousands of my own patients over the first part of my career, and then now after having some small role in assisting hundreds of other doctors treat millions of patients. The goals of care that you establish with the assistance of your patient's desires are critical to moving this forward. If the patient wants only pain relief, well, that's simple. They're done when they're pain-free and not a day longer than that. release them from care if that's the case. If they desire maintenance or wellness care, then they move into that phase if you provide such care in your clinic. If the patient wants normal curves or normal alignment, and you practice one of the few techniques that are based on achieving this goal with certainty, then they're done with care when their curves or alignment are normal and not a day longer. I propose and teach a model based on function. If that fits within your paradigm of care, it's a great place to be. But how do you get there? Function is actually easy to measure today. It's never been simpler. There are several really well-referenced and thoroughly cited movement screens that you can put your patients through at regular intervals. It's not a one and done. It's done at intervals. So for example, your patients put through their first movement screen in their initial examination, and then movement deficiencies are clearly noted and are establishing the baseline for each new patient. These deficiencies become and must be measured objectively by a well-trained doctor or a team member. Now, taking it a step further, a plan of care that's designed to quickly eliminate movement deficiencies, well, that can be employed so that you ensure maximum functional correction is attained for each individual patient. This, of course, would entail a custom program of care for each patient. A one-size-fits-all approach absolutely will not work. Driving them in a subscription program will not work either. As the patient progresses through their care program, the movement screen's repeated and compared against the baseline that was previously established at the initial examination. So if the care you're providing is truly what's best for the patient, you're going to see fairly rapid changes and improvements in the patient's movement screen results. In other words, you're improving function greatly. These repeat movement screens, well, they generate the data to make custom alterations to the treatment program to continue to get maximum movement functionally restored to that individual patient. So everybody's unique. You see how clean and transparent and really simple this approach is for everyone? It absolutely is. So as chiropractors, we tend to talk a lot about restoring function. And to achieve that end, it requires that the patient's movement function's measured at regular intervals. When the patient no longer progresses, one of two things have occurred. Number one, either the patient's receiving the wrong treatment for their current condition, or they have reached maximum medical improvements. And since no two patients are identical, that requires really sound judgment, your sound judgment, based on being a movement expert. This is disguised as experience. And who better to be a movement expert than a DC, highly trained in kinesiology, physiology, and all the other ramifications. Now, in today's day and age, a data-based approach to patient care can dramatically help you build a really fantastic and thriving practice. And when you consistently over-deliver to your patients, they begin to refer others into your practice. This is a great barometer for how well you're doing for your current patients. Are you receiving a lot of referred new patients? Well, then phenomenal job. You're over-delivering and you're building a practice that can fuel an incredible life. In my opinion, if you run a fairly young practice right now, half of your patients should be from referrals and the other half from marketing activities. A more mature practice relies much less on marketing when run correctly. This is a healthy practice that is truly changing lives, and it's a blast to run. So what percentage of your new patients come from referrals? And how many referred new patients do you typically receive in a given month? Tell us about it in the comments section. It gives people a good idea what's going on in today's world. Know this, you really can build an incredible practice on just 30 new patients a month, 15 from referrals, 15 from marketing. If you found this video interesting and helpful, grab our free report for chiropractors at hsfranchising.com. It'll show you how to scale your state-of-the-art practice in today's environment. It's a game plan that we're currently following, and it's made these last 3 years just massive growth. Blew away our projections. You can do exactly the same thing. If you want what others have, do what they do, you get what they get. And again, so head on over to hsfranchising.com and check out the videos. I think you're going to like them. And as always, I welcome your feedback and opinions on this topic in the comments below. I look forward to hearing from you. Have an awesome day.